So everybody asks me this question, so what are you doing differently? So when I invite people to come and visit my rehabilitation center, and after they visit, they tell me this, doctors, non-doctors, especially my doctor colleagues, especially my neurology and neurosurgery colleagues, they say, I was always wondering, why is Sharan inviting me to see a physiotherapy center? So because physiotherapy is a very common word that people understand or know, because it is related to orthopedics. You know, you've got this injury, you've got this knee pain, you've got this tennis elbow, you've got this back pain, whatever it is, you go to a physiotherapist, orthopedics will send you there, they do something and you get better. So that's what people are familiar with. Now, neurorehabilitation is not physiotherapy. It's much more than physiotherapy. Now, that is what most people understand. I'll give you an example. See, we bank with ICICI Bank. And about 3 years after we started this company, I went to meet the manager, and the manager happens to be a friend of mine, a school friend. Sorry. And he was telling me, he had consulted me on the phone with one of his uncles who had a stroke in Mysore, and we had had a chat. And he told me, hey, you remember that uncle you spoke about? Guru, he's been taken home, but still not okay, boss. He's still having problems. He can't walk. He's not able to talk properly. He's having memory issues, this and that. What do you think? I said, boss, he needs neurorehabilitation. Andre? He asked me. I said, he needs neurorehab. Andre, no. That means here is a guy born, brought up in Bangalore city in the 21st century, working for ICICI Bank, who had no clue, and he's hearing the word neurorehabilitation for the first time. So imagine what's going on in the market. So neurorehabilitation is not physiotherapy. That's the first message people need to get. Because physiotherapy is, they move the hand, they move the leg, that's what they're doing. They're more movement related. But the problem is not downstairs, the problem is upstairs here. So it doesn't matter how much you move downstairs, unless you get these damn circuits connected, nothing is going to happen. I realized that very early, that there were two fundamental mistakes people were making or not addressing. Number one, they are not addressing the upstairs, they are trying to address the downstairs, which is not going to work. Number two, there's software issues apart from hardware issues. So these are two things that they never understood what was going on, and that was the biggest trick. That's why we said we brought up a new way of approaching neurorehabilitation when compared to what currently was going on in the market at the time. That's why we named our brand as Neuro, N-E-W-R-O. So we are a neuro with a W, that's what I say, and it's a new way of doing rehabilitation. That's the first thing. Second thing I realized was rehabilitation, most patients even refer to rehabilitation once they're out of hospital. And some of them take 3 months to get out of hospital. And by the time there's already a mess because the hand is not moved, the shoulder is stuck, the hand is stuck, the leg is stuck. So I realized I had to start rehab very early. Abroad, they already have this concept of very early rehab, ICU and all of that. But somehow, see, in India, what was happening was we are struggling still with primary care. We're still trying to, save mothers, save the children, pick up after an accident. We still have so many logistics in that saving life category that we have to address still. So nobody is looking at quality of life issues. I've heard doctors saying that, if one patient who's walking comes and complains to him that I'm not okay, you are better than him. Just because his car is driving in second gear, it doesn't mean my car has to drive in second gear. It has to work in top speed. I want my vehicle to be in full speed. So there's a level of cynicism and resignation even among medical professionals as So that is what actually that chalta hai attitude and that part of it actually even stopped people from looking at can something more be done. So that's what we try to redefine by saying, listen, number one, we are nobody to decide whose future is what. Our job, like how Krishna told Arjuna in Mahabharata, to fight is your duty. And number one, and number two, you fight to win, not fight to just hang around. That's what it is. So I tell everybody, listen, I'm an eternal optimist, I fight to win. We do the best we can. Eventually it's this destiny that's going to happen. So that's the next thing that had to happen, that we had to make sure we deliver the right kind of rehabilitation. And neuro rehab consists of physiotherapy, occupational therapy, speech therapy, language therapy, swallow therapy, memory therapy, cognitive therapy, behavioral therapy, and pain therapy. So it's not physics, it is physics, mathematics, science, language, art, physical, everything. It's like a school at the end of the day. So unless everything is delivered, It's not going to work. And there's no one organization in India today which is delivering it end to end. I'm proud to say that PRS Neurosciences is probably the first and only company which is delivering quality neurorehabilitation at affordable cost, right from the ICU, second day on ventilator patients, all the way to a resort. At different stages, it's like a child going through nursery to primary school to middle school to high school to college. We are holding the family's hands all along. The families have no clue what is to be done. They need help, they need direction. When we talked to them, they said, "Doctor, you are the first people who told us all these things. We didn't know what was going on." So that's when we felt that we had to establish this, a whole comprehensive, affordable system that can hold somebody's hand from end to end.